Joining us now is Dr. Devi Nampiaparampil, Associate Professor at NYU School of Medicine, a frontline worker herself as well. Dr. Devi, good to have you back on. We've all got friends that work in hospitals. I know some frontline workers myself, and I'm just going to tell you, they're cooked. They're just exhausted. It's been a year and a half. Some of them have had no more than one day off in almost 2 years. And you get the feeling that a lot of these folks who are amazing, but they're not superhuman, are at the breaking point. Is there something we can do to help these people continue to help us?
I don't know if it's something specific. I mean, we can take precautions. We talk about COVID a lot, which of course we could take the precautions in terms of protecting ourselves, trying to do whatever we can in terms of the vaccine and the masks and the other precautions. But there's actually a lot involved. I mean, if I think about what's overwhelming the healthcare system, we talk about Omicron and COVID, but there are also issues in terms of healthcare worker fatigue. For example, a lot of the shortages are related to people going on leave now because they have been working for 2 years. So the number of staffing is less, right? So we need some of the folks to come back as well, return to the hospital. And I think that has to do a little bit more with management as well, rather than the people out in the community. Second, we have issues where a lot of the folks, we think about the healthcare workers themselves, like doctors and nurses, but there are a lot of folks that are support staff for the hospital. So let's say the folks in dietary, people who are cleaning the rooms, housekeeping, right? People who are doing the laundry. So anybody that supports the healthcare system also, we have shortages of those folks in general as well. So I think that there are a lot of folks that support the healthcare system that we need as well. And all of that is reducing the number of beds available. Some of these strategies that are done, like to reduce the elective procedures and things within hospitals, I think that may be harming things because we also have patients that need healthcare. As of the past 2 years, the patients themselves have been waiting too to get procedures done. So on top of COVID, we have a sicker population that may also be vulnerable to the virus itself.
And this, okay, and by the way, a lot of healthcare workers, I'm not advocating for or against them. It's not my role, but the vaccine mandates have, we know, factually pushed out thousands of healthcare workers across the country. But I want to focus on something else, and it's a bit controversial, Dr. Devi, but I know you can handle it because this is the world you live in now, which is, there was an article in The Atlantic about a month ago saying about 45% of hospitalizations for COVID should not be hospitalizations. They're either things that are like a broken ankle and then you find out you have COVID, or there's a lot of people who are so afraid of it, and I've talked to ER doctors about this, where they're coming in effectively having anxiety attacks because they have a fever and they assume they're going to immediately die of COVID. I'm not joking. And they say a lot of these people are basically working themselves up into a frenzy even while fully vaccinated. From your perch, are we seeing non-necessary hospitalizations maybe crowding out those that are necessary for people with, like, in a car accident?
So the people that need to be hospitalized often do end up in the hospital either way. But you're right that sometimes people will come to the ER and to divert some of the resources that occurs. But I think it's still better for someone who is concerned to come into the hospital and get assessed there. So that does happen. But I think you've hit on a larger issue that we have a problem where the hospitalizations and deaths, you know, it's confusing about whether these are true COVID hospitalizations or true deaths. Because, for example, as someone who has filled out death certificates, there's usually not just one cause of death. There's a primary cause of death, and then there are several others. So a person, for example, who has COVID or some other virus, it's not always the only thing that killed them. They may have heart disease, they may have cancer, they may have several things that put them in the hospital. And maybe COVID is another factor that affected them and pushed them over the edge, and then this person passed away. So what's happened that we've seen, even, I think this is what leads to a lot of the mixed messaging and confusion as well, is that when this pandemic started, we saw people who had no other risk factors necessarily. Sometimes they caught COVID and then they passed away. So that's why people were so terrified. But now we see people where, as you mentioned, they may have had a sprained ankle. They otherwise look pretty healthy, you know, and then they get diagnosed with COVID and it goes down as a COVID hospitalization. Or you see somebody who had multiple other problems and it gets labeled as COVID. So we need some clarification about whether COVID is truly the thing that cause them to get pushed over the edge or whether it's an
Yeah.
antecedent factor.